Hi, I'm Gary Bebow, CEO of White River Health System, and this is my CEO Connection for September. One of the first things I want to talk to you a bit about is the closure of Crittenden Hospital over in West Memphis. You know, there's been a lot of action going on in our industry recently, and a lot of hospitals are having some difficulty in how do they comply with health reform and what the effect is on their institutions. And you know, to digress a little bit, I want to talk some about White River Health System. First of all, I want to talk to you about the positive things that are happening here and a lot of the things that you all should feel really good about our current situation and our future sustainability. You know, we've been doing some benchmarking of our results to other institutions on a national and statewide basis, and the good news is there are some real opportunities for us to improve further, thus making our institution be better from a viability perspective and also, you know, just the security of jobs. So let me talk to you a bit about some of the things that we got going on right now. First of all, we've identified through our benchmarking that there's some opportunities in our revenue cycle. You know, revenue cycle by definition is the monies that we collect for the services that we provide. And you know, when we look at how we do compared to other hospitals, I mean, there's some areas where we really can get a lot better. For example, we noticed from our documentation that our documentation could get somewhat better so that we could get a higher reimbursement for the patients that we see. And so this, in the upcoming future, we're going to do more in terms of assuring our documentation is complete. Also, we got to look in our revenue cycle at our billing and our collection practices, making sure that we get every penny we have a legitimate right to, but not a penny more. And so from a revenue cycle, I think there's some real great opportunities that we can do better with. Another thing that we've looked at from a benchmarking perspective is how long do patients actually stay in the hospital? And we noticed by comparing us to others that, you know, in many cases, patients are staying longer at our hospital than patients are in other institutions for very similar diagnoses. So we're doing some prioritization of those diagnoses where patients are staying longer here than other places, and try to deep dive into the reasons for those to see if there's not ways that we can shorten that length of stay. So because by shortening the length of stay, not only do fewer supplies are used, fewer resources are consumed, and frankly, the sooner patients leave this environment, the better for them health-wise as well. So average length of stay, well, that's another initiative that we're really going to be working hard on. We looked at our supplies used for each admission at the hospital, and again, we found that there are some opportunities to reduce the supplies costs at our hospital. Now, when you break down our supplies costs, there's several components of it. One is what's our purchasing effectiveness in terms of, are we getting the best prices for the stuff that we use? And I'm proud to say that our purchasing department does a really good job in the procurement of supplies at the very best prices. So, you know, I don't think there's a lot of work we got to do there more than what we are right now. Obviously staying attentive to that, but the real improvement in terms of the supplies cost is the quantity of supplies we use for each patient we see. And perhaps also another way to look at that is, are there lower cost alternatives to the supplies that we're using? So some of that will be working with the medical staff to determine if there are ways to go to a lower cost alternative, but I need to have each one of you to also evaluate that yourselves. Are there times when we could use fewer of the products during a patient's stay? And in addition, is there a lower cost alternative to the supplies we're using? And you know, by the input of all of us together, I think we can really do a better job in our supplies cost. You know, another area we're really looking hard at is in the area of quality. You know, quality, there's ways that we can get additional funding based upon how we do quality at our hospital. For example, under the Medicare value-based purchasing program, we could do better. And last year, actually, we got penalized for about $40,000 because of our results in patient satisfaction, in our compliance with Medicare core measures, our mortality rates, and those types of things. So we can do better in value-based purchasing, and I know every one of us has got a role that can play in value-based purchasing. Another area under the area of quality is in the area of readmissions. we right now are held to a high standard to make sure that once patients are discharged from the hospital, they don't get readmitted within 30 days. And so right now our readmission rate is too high, and we need to do a better job at our discharge planning and follow up with patients to make sure that when they leave the hospital, we do everything we can to make sure that they're ready to go home, but also assist them to make sure that they don't have to re-access the hospital within 30 days following that discharge. And so, those are areas that we can really do better as well. Finally, you might want to ask about how we do in labor. How about our manpower costs? And I want to tell you that I think our manpower costs are okay. I don't think we have too many employees, and I don't think we pay employees too much. So I think overall, our labor costs at this hospital is fine. Now, that does not mean that there's not pockets within the organization that we can do better. And we're submitting some data for benchmarking purposes to see, is there some locations, are there some areas in the hospital where we could do better in our labor costs. But overall, I think we're okay there. So I want to leave this topic now just assuring you that we have not let this go unnoticed, that leadership is taking actions and asking for your help in making our performance better. So help us through this process. I think that we're on the right track, and things will improve in the near future. The standard of the month is safety. And that's everybody's responsibility to provide a safe environment for patients and visitors at the hospital. It's a matter of whether we practice the best evidence-based care in terms of safety, but also making sure that the spills are wiped up and that the environment is just safe for our patients and visitors when they come here. So during this month of September, let's pay close attention to how safe we have the environment for patients and visitors. In terms of staff additions, I'm proud to talk about two new additions to the hospital. One is Amanda Roberts, who is now our director of the White River Health System Foundation. Amanda has got extensive experience in fundraising, and you'll be seeing a lot of her. So welcome Amanda aboard, and provide assistance any way you can. The other major addition is Blake Wilbanks. He's a chef that works in our dietary department. Blake has got some great ideas to create a more healthier nutritional menu in the cafeteria, and also patient room service will be starting in September. So when you see Blake around, welcome him. I've had the opportunity to taste some of Chef Wilbanks' work, and I know you'll all be really proud of the work he'll do for us. We'll be opening up the Tuckerman Medical Clinic in September. Over the past, Tuckerman really hasn't had a medical clinic, and they reached out to us and to provide that service. And I'm proud to say that Colleen Blanchard will be our advanced practical nurse that will be staffing the clinic. And sometime near the end of September, we'll actually have an open house, and we'll let you all know when that is. And if you're in the area, we hope you'll stop by and wish our new clinic the best of success. Each month we do a community education presentation, and on September 9th, Dr. Doug Bernard will make a presentation in the conference center dealing with the importance of annual exams. Lunch will be served, and if you're available that day, I hope you'll come and provide support to Dr. Bernard in his presentation. I know it'll be well worth your time. Each year we do a free prostate screening at White River Medical Center. And this year, on September 9th, we'll be doing that from 5 o'clock to 8 o'clock p.m. As usual, events like this are very important that we have volunteers to make it a success. If you're available on September 9th from 5 to 8 o'clock p.m., let marketing know. Similar to the free prostate screening, we're going to have a Health First event on October 14th from 4 o'clock to 7 p.m. We do the Women's Night Out with First Community Bank each year, and if you're available on October 14th from 4 to 7 p.m., please let marketing know so that we can get you engaged in that very important community event. This concludes my September CEO Connection. I know it's a little bit longer than what it has been in the past, but I hope the information has been helpful to you, and I want to encourage you to do your very best to keep this institution going well and providing the excellent medical care that our community deserves. So any suggestions, be sure to send them along to make the CEO Connection even better in the future. Thank you.